surgery training for developing countries, the breakthrough and the drawbacks. As the introduction, neurosurgery is a field with a demanding surgical skill. We need a lifetime learning, training to achieve proficiency. However, technologies make it possible to achieve this in practical way. But in my country, especially in my center, the fundamental teaching process in neurosurgery is didactic mentorship, with training to the model or cadaver before hands-on to the patient, like see one, do one, teach one method. So we rarely use those advanced technologies such as robotic system, intra-op MRI, navigation system, AR and VR, AI and machine learning. And this leads to variation of experience, successful error, results, errors, even harmful effects among the residents. But in contrast, when we graduated from the neurosurgery, the promotion of those advanced technology are very robust. These are the theoretical literature review with the Science Direct as the database. Using those keywords, we generated 3,382 results, narrowing to 963 articles. So those are the advanced technologies utilizations for brain surgery and spine surgery. The key differences are in the brain surgery, the main goal is the functional preservation and real-time tumor lesion visualization. And in spine surgery, mainly for the precision instrumentation, minimally invasive access, and biomechanical stability. So there was a survey by the European Neurosurgery Association, the WFNS committee, about the use of advanced technology for pre-op planning the cranial surgery, with the respondent is the resident and the board-certified neurosurgeons, and 23% of them never been trained for those technologies. And the conclusion, the very useful tool for the pre-op planning for the cranial surgery is the software for 3D visualization of DICOM datasets, but simulation tools based on AR, VR, or mixed reality are considered less valuable, less used than other technologies. Those are the benefits and limitations in the brain surgery for the advanced technology. As we can see here, the less expensive is the more need the learning curve and surgical skill like endoscopic skull-base ventricular surgery and awake craniotomy. And it's the same with the spine surgery. The less expensive is the more surgical skill you need to master everything like endoscopic spine surgery and tubular retractor system. And in the spine surgery, those advanced technology are very expensive, and because of the reason to precision and accuracy of the instrumentation, so the promotion of those technologies are very rare. So those are the drawbacks. You have to remember the over-reliance, lower anatomic knowledge, less tactile skill development in robotic surgery if you do it in training, and then the disadvantage of robotic surgery like lack of the sensory feedback. And then there's an ethical issue in AI system like data breach and unauthorized access. So we cannot be discouraged with those technologies because human and technologies can work together. And the role of robotic surgery in the neurological cases by Lin and friends from China, they said still freehand surgeries has the higher accuracy for now, but we have to be open-minded for this robotic system. So we have to remember the ethics in neurosurgery from WFNS in 2011 that we must maintain a high level of professional competence and ensure a high standard of training of the young neurosurgeons. And the conclusion is, we think hand-on training is indispensable. It is very paramount. Technologies are adjuvants. The optimal utilization of advanced technologies are good in the trained neurosurgeons and those with sufficient surgical skill to realize the potential harmfulness and the proper usage of the technologies. But in the developing country, yes, it could be applied with the challenges like cost barrier, learning curve, and infrastructure problem. So thank you for the opportunity. Those are my reference.
Very well said, Sevline.
Thank you.
Strong work. So the next speaker is Nicholas.
No, he's not here.
He's not here. And there are a couple of people who has sent me direct message that they are part of this presentation, but I'm not sure. I don't see their name. It's Piedad Acurio. She has sent me a direct message, and I'm not too sure that whether it's one of the presenter, but it's not in my schedule. But I think that if not, then this conclude the session. And thank you very much for all the speaker. Thank you, my co-moderator, Dr. Sheikh, and thank you, Professor Sharif and